Bismillah ar-Rahman ar-Rahim. In that video, I will speak about chronic obstructive pulmonary disease in a chest X-ray or radiology investigation. First, we should check the penetration. Look at the vertebral bodies behind the heart. In case of good quality, the X-ray, the vertebral bodies becomes harder to see behind the heart shadow. If they are too clearly seen, the film is over penetrated, making the lungs appear black. The diaphragm shape. The shape of the diaphragm in COPD will be flat or even scallop shaped instead of concave upwards. This is a more reliable sign of hyperexpansion than rib counting. In chest X-ray also will find the lungs look larger in volume than normal. The diaphragm are rather flattened. The right upper zone and many areas of flat lungs are abnormally black, as in this chest X-ray. The blood vessels are difficult to see or are very thin because of areas of lung have developed emphysema. Count the number of the ribs. You should count it anteriorly. If the lungs are enlarged, you should be able to count more than 7 ribs. But be careful, however, because you can sometimes count more than 7 ribs in normal if they are tall and slim. Then if you are uh, then if you are satisfied with technical quality of the film, then the most likely cause of COPD is associated with large lungs, as we said, due to air trapping and development of the body, as in this CT image. Also, we should look at the shape of the heart. The enlarged thorax of COPD appears on X-ray due to elongate and narrow heart, elevating the lower border. The heart, instead of sitting on the diaphragm, often appear to swing to the wind. It will also appear small unless there is also an element of cardiac failure, in which case it will be normal in size or large. So again, the shape of the heart uh, in case of COPD will be elongated and narrowed. Okay, so the shape of the heart is elongated and narrowed. What's called ribbon-shaped heart, which is elongated and narrowed. But sometimes, if there is heart failure, you can find it may be appear or it may appear large or normal in size. Look of the body. Density. These are densely black areas of the lung, usually round, surrounded by fine curvilinear shadows. Bolli distort the surrounding vasculatures so the shape to help find them look out of areas of distortion of the vascular markings. Also should look at the distribution of the lung markings. The black lungs of COPD are due to reduced size of blood vessels. The lung markings are reduced bilaterally and fan out in straight lines from the hilum, starting off chunkily but stopping 2/3 of the way out of the peripheral pruning. This is a CT image of case of COPD. We'll find here there is black areas of earcysts or bulli. There is narrowed blood vessels or even disappeared blood vessels, very thin. You cannot see it because of the bulli or emphysema. You can find also black and air trapping of air trapping sign in the that image.